The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Welcome to the Dr. Fazil Show. My name is Wendy and I'm here with Dr. Fazil today. We're going to be having a little bit of a discussion on saving the kidneys.
Thank you, Wendy, for having me in Dr. Fazil TV show. As you know, my name is Dr. Fazil. I'm an internal medical specialist as well as a kidney specialist, a nephrologist. So we are going to be talking about saving the kidneys through intake of better diet.
Dr. Fazil, what is the correct amount of water intake that each individual should take or drink each day?
All right, Wendy, this is a very good question. A lot of patients do ask how much water is enough. There's no magic number. If you have to pick up a number randomly, then 1.5 liter a day in 24 hours is enough. That includes all the fluids, including soda, water, coffee, juices, and free water. But everybody's different. If you have a heart problem, if you have a liver problem, if you have a kidney problem, you might have to drink less. If you are in a hot weather, you might have to drink more. So it's a very variable factor. But one way to look at it, how much water you're drinking or you should be drinking, your body will tell you. If you're hungry and thirsty, you will drink more automatically. But if you look at your legs every day or weigh yourself, and if your weight is increasing dramatically or your legs are getting more swollen, then your body is telling you that you're drinking more water than you should be drinking. So you should cut your water intake automatically. So for a normal person, if you have no medical issues at all, in a normal weather, the approximate amount of water is 1.5 liter a day. That includes all the fluids from different sources. If you have a liver problem, kidney problem, or a heart problem, you have to drink less. If you're in a hot weather, you have to drink more. So I hope that helps.
Thank you. Dr. Fazil, what is a kidney diet?
So Wendy, the kidney diet, when we say is a generic term, it can be, generally it is a low phosphorus and low potassium diet. Most people, when they have kidney problem, they tend to build potassium and phosphorus in their blood. Generally, it does not happen in early phases, but in the later phase of kidney dysfunction, the phosphorus start to build up and the potassium start to build up, and they have to be careful in eating foods which are low in phosphorus and low in potassium. So low phosphorus and low potassium diet would be kidney diet. Not recommended for everybody, but is recommended for patients which are in advanced stage of kidney disease.
Dr. Fazil, what are some foods that are high in phosphorus that we should avoid?
So that's a very good question, Wendy. A lot of people do ask. Most common causes, most foods which are high in phosphorus are like dairy products, milk, eggs, poultry, nuts, almonds, cashews, meat. They're high in phosphorus.
And Dr. Fazil, what are foods that are higher in potassium that we should avoid?
So, Wendy, the food which are high in potassium are oranges and bananas, potatoes, and in Arizona, actually, cactus is used very commonly as a food. But cactus is very high in potassium, so we should avoid cactus. And I always ask my patients if they're taking cactus supplements or using cactus in their food, and I'm sometimes very surprised that they do take cactus, and that need to be stopped. And when you have advanced kidney disease, no cactus.
Thank you. Dr. Fazil, how would a person know if their kidneys have been compromised?
So the kidney disease at an early stage would not cause any problems. You would not have any symptoms, and it's very asymptomatic. Mostly you will find out on the blood test, so it's very important to talk to your primary care doctor that if you have any kidney problems, sometimes we have window of opportunity, and without any symptoms, we especially when you're in stage 3, there are 5 stages by the way. One is normal, stage 5, and somebody needs dialysis. In stage 3, most people do not have any symptoms, and generally they are picked up on the blood test. Stage 4 and stage 5 is when they start to have swelling in the legs, start to have itching on the skin, weakness, and even stage 5 they can even pass out and go to coma as well.
Now we're going to take some questions from the audience, Dr. Fazil, if that would be okay, and let the audience ask their questions.
Definitely, Wendy, I'm pleased to answer the question of the audience. Let's start the panel.
Dr. Fazil, the first question is from Michelle in the audience, and she'd like to know, are there any medications that she could be taking for other disorders that she should be avoiding because of her kidneys?
That's a good question, Michelle. There's most common medications which most people don't know is NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, and levonaproxen. They're commonly and sometimes heavily used for arthritis and pain. They can cause severe impairment to the kidney function problems, and if you already have kidney problem, you should definitely avoid that or ask your primary care doctor.
Okay. Dr. Fazil, our next question comes from Roger in the audience, and he would like to know, does a urine color indicate any type of kidney functioning?
So, yes, if you are very vigilant, if you look at your urine and if it suddenly becomes frothy and in the toilet, then it shows that you might be spilling a lot of protein in the urine, and then you should seek the medical attention. If the color is too dark, it might mean that you're dehydrated and you need to drink more water, or any bad smell in the urine can indicate infection. A frequency of urination can also mean infection. If there's blood in the urine, that's also a very significant sign, and they should immediately talk to the doctor if there's any where the blood is coming from. Normally we should not have any blood in the urine. Sometimes you cannot see the blood in the urine by the naked eye. Sometimes you have to use the microscope or the special test, but if you're seeing blood through the naked eye, that means there's a bleeding from the bladder or from kidneys, and that's definitely abnormal, and you should seek the medical help.
Dr. Fazil, this question is from George in the audience. He would like to know, what are the effects of drinking alcohol and your kidneys?
George, is no direct effect of the alcohol on kidneys, but their indirect effect. Alcohol, as all we know, is bad for the liver. Too much intake of alcohol can cause liver damage, and the liver can cause a condition known as hepatorenal syndrome. That means it can compromise the kidney function through a very complicated pathway. So if you do have a kidney problem, I will say if you do not have a liver problem, stay in moderation, and because if you end up having a liver problem, it can make it more complicated to manage the kidney issues.
We have no further questions from our audience. I'd like to thank you, Dr. Fazil, for taking this time to share your knowledge with us and the excellent information that you have shared with us.
Thank you, Wendy, for having me today in Dr. Fazil TV show on the kidney issues.
Thank you for joining us, and we look forward to seeing you again in our next episode.
Thank you for being with us today, and save your kidneys. Always talk to your primary care doctor if you have kidney issues, and immediately seek a kidney specialist help if you do have a kidney problem. Please stay safe. Save your kidneys.